Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to have a conversation with Laura Dix. She's Managing Director at Accenture's Life Sciences Strategy and Consulting Practice located in London, England. She's joining us to discuss some new research titled The New Rules of Engagement. This research examined how pharmaceutical companies can give healthcare providers some new and meaningful interactions. Welcome to Health Professional Radio, Laura Dix. Thank you for joining us this morning.
Hi there, I'm delighted to be here.
Well, give our listeners a brief look into your professional background and speak briefly on what it means to be Managing Director at Accenture's Life Sciences Strategy and Consulting Practice.
No problem at all, Neil. So I've been part of the Accenture team for the last 15 years, most of which has been within life sciences. And I sit within what we call strategy and consulting. And my focus is on helping our clients in the pharmaceutical industry help engage their customers, be it HCPs or patients, and think about the most relevant, appropriate, impactful way of doing so. So it means a lot to me. It feels very purposeful to do, and it's great to be here to talk more about our recent research.
Now, concerning that research, I understand that your company found that healthcare providers are getting content that's a lot more relevant than before the COVID-19 crisis. What types of content are best resonating with healthcare providers, and what makes certain pieces of content more valuable than other pieces of content to healthcare providers?
So it's really interesting. When we asked healthcare providers to tell us about the best piece of content that they'd recently received, a third highlighted that it was content that they could easily pass on directly to their patients to help them. And almost a further 20% opted for content that could help them with the administration associated with treating their patients. It was interesting to see that just 8% favoured an interesting piece of promotional content as their number one piece of content of choice. However, though, regardless of the impact of the content itself, one thing we did note in the research is that valuable content also risks getting lost in the noise, in sort of the sheer volume of information that HCPs still receive over a year after the pandemic began. So almost 2/3 in that spirit told us that they felt at least one pharmaceutical company had spammed them with digital content as the COVID pandemic had evolved. But what's really interesting, and I think just worth highlighting as well as we ponder this question, is that we discovered that getting relevance right isn't just about the content itself. And when we asked HCPs about the best interactions that they'd had with pharmaceutical companies recently, we dug deeper into the characteristics of those engagements that resonated best. So we were considering, are the most valuable exchanges with pharma those that are the most responsive, the most on-demand, the most empathetic, the most human and authentic, and such the like. And while all of those things, and actually more, have a role to play, we concluded, as ingredients to this valuable experience, we also concluded that there's no one-size-fits-all recipe for success, and different therapy areas value different modes of engagement, just as different individuals do.
You know, I was always under the impression that when healthcare providers were dealing with pharmaceuticals companies, it was simply a matter of, do you have the drugs that I need and can you distribute them as I prescribe them? I was not aware that there was such a need for better outcomes and better relationships between those two entities as it related to patient outcomes.
Absolutely, and it's really interesting, Neil. So, if we think about how have pharmaceutical companies changed the types of information that they're sharing, first of all, we noted in our research a very positive trend that almost 9 in 10 of the HCPs we surveyed said that they've seen pharma change what they communicate about to be truly helpful. And I think just thinking about your comment there, what's really interesting, actually in a similar trend to our 2020 HCP research, is that in 2021, HCPs continue to see pharma companies diversifying their communications and their support services beyond product information into services that are really, helpful and provide additional value, often specific to the pandemic. So themes like affordability programs for patients economically impacted by COVID-19, helping patients understand where they can access treatment centres during the pandemic, education on how to better treat patients remotely, how treatment options may change post-COVID-19. These were just some of the services regarded as more helpful to HCPs in 2021 compared to before the pandemic. And I think it's interesting. I think these changes do seem to serve and support the ways HCPs regard COVID-19 as impacting patient care. We had almost 7 in 10 tell us in our survey that COVID-19 will change the way they administer and manage some patient treatment in the future. And over 7 in 10 noted that COVID has changed the way patients use technology to manage their conditions. So we definitely have, as you say, observed almost a repositioning of the value that pharmaceutical companies offer and can offer in these times.
Should this pandemic end in the same way that others have? You say that these pharmaceutical companies and healthcare providers are enjoying, for lack of a better term, this newfound efficiency and the sharing of pertinent information. Do you think that this is going to be the norm? And is this how other efficient practices came to be during, in the face of crisis?
Yeah, I definitely think, this has given us a real moment of reckoning around how do you optimize somebody's time. And interestingly, in our research, we did find that, a number of HCPs said they had more capacity. But I guess the question is, how do you use that capacity really efficiently and make that precious time and attention as valuable as you can? And I think, as we go forward and we think about the lessons learned during the pandemic, we're noting actually that many HCPs do value the mode of interaction to be more virtual than before, and that despite the lifting of travel restrictions in many countries, we're not seeing a significant return to face-to-face engagements with pharma. Actually, the proportion of HCP meetings with reps held virtually was over 6 in 10 in 2021 compared to 36% before the pandemic. And I think what I found particularly interesting in our research, only a slight dip from the proportion of 65% recorded in 2020. So well after the pandemic begins, we're seeing really the settling almost of these trends around the ways HCPs want to be engaged. And what's really interesting is looking ahead to the future, almost 4 in 10 tell us they want all meetings to continue to be virtual after the pandemic ends. And actually almost 50%, in addition to that, say they prefer this hybrid approach of virtual and in person. I think another really interesting learning from this that we take forward is that only 4% of the HCPs that we surveyed said that they don't want meetings at all. And that to me indicates that this human connection, whether it's face-to-face or through a different channel, remains much valued and will have a role to play, even if not in the old-style physical form long after the pandemic ends.
Is there anything that you'd like to add before I ask for a website where we can learn more?
Absolutely. I think one really interesting thing that came out of the research that I haven't already covered was our observation that healthcare professionals are recognizing and remembering those companies that provide the most meaningful engagements. And even more so than that, they're rewarding that recognition with more time and attention. We noted in our research that almost 4 in 10 would be more likely to meet again with a company that provided a best experience, and that nearly 9 in 10 would be more willing to meet with others, or twice as likely actually to meet with other companies' reps if their best relationship was replicated. So I think, the opportunity really to embrace these shifts and what they offer in terms of creating a really personalized, meaningful interaction that HCPs will truly value have never been so great.
Well, give us a website where we can learn more about Accenture and the services that you're offering and looking into.
Absolutely. So you can go to www.accenture.com, and within the website you can navigate to our dedicated area for life sciences, where we focus in more detail on our offerings and stories.
Laura, it's been a pleasure speaking with you this morning. I appreciate you taking the time out to give us this information. Thank you very much.
Thank you, Neil. It's a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Laura Dix. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.